Hi medicos, welcome to my YouTube channel, Indian Anatomist. Medicos, nurses, and other healthcare workers, who write and read case reports should be aware of the problem we talked about today. Abbreviations, also called acronyms, are short forms of words, or sentences that mean the same thing as the full word. It is important to use acronyms to avoid misunderstandings that could have serious consequences for both patients and healthcare professionals. From the second year of medical school, you learn how to help your primary care physician, and any other doctors who are involved in your treatment, communicate with each other, through your medical records and case reports. Healthcare providers can communicate more efficiently when you use acronyms in your reports. Those without medical training should not attempt these. Here is a list of medical abbreviations that are used often. This list is not exhaustive, but it will provide you with definitions for terms that you are likely to see frequently. If you require further clarification about the content of a message, don't hesitate to reach out to the creator. The frequently employed abbreviations are highlighted with yellow color for your convenience. L in brackets, indicating the Latin terminology. 1 is A/G ratio, albumin to globulin ratio. 2, A/P, assessment and plan. 3 is AC, anti-cybum, or before the meal. For example, as in taking medicine before meals. 4, ACL, anterior cruciate ligament. ACL injuries are common knee ligament problems. Trauma or deterioration can sprain or tear the ACL. 5, ad lib, ad libitum, or at liberty. A patient may be allowed to leave bed and have ad lib activities. 6, ADH, antidiuretic hormone. 7 is ADHD, indicates attention deficit hyperactivity disorder. 8, ADR, adverse drug reaction. For example, taking a prescription medicine for high blood pressure can cause an adverse effect reaction. 9, AFR, acute renal failure. 10, AIDS, acquired immune deficiency syndrome. 11, AKA, above the knee amputation. 12, ALL, acute lymphoblastic leukemia. 13, AMI, acute myocardial infarction or heart attack. 14 is ANED, alive, no evidence of disease. For example, the person went to the emergency, living, and showed no evidence of disease. 15, anuric, not producing urine. For example, anuric person is usually very sick and may need dialysis. 16, ARDS, acute respiratory distress syndrome. 17, ARF, acute renal or kidney failure. 18, ASCVD, atherosclerotic cardiovascular disease, a form of heart disease. 19, BID, bis in die, or twice daily. For example, taking medicine twice daily. 20, BALL, B-cell, acute lymphoblastic leukemia. 21, bandemia, elevated amount of immature forms of neutrophils. 22 is BBF, before breakfast. 23, bibasilar, at the bases of both lungs. Example, lung pneumonia patients may have strange bibasilar breath sounds. 24, BKA, below the knee amputation. 25, BLD, means blood. 26, BMI, body mass index, calculated number, based on height and weight. 27, BMP, basic metabolic panel or profile for electrolytes. For example, potassium, sodium, carbon dioxide, chlorides, glucose and creatinine. 28 is BP, blood pressure. Is a physical checkup. Taking blood pressure is one of the vital signs. 29, BPD, borderline personality disorder, a personality disorder. 30. BSO, bilateral salpingo, oophorectomy. Total abdominal hysterectomy includes a BSO, which removes the ovaries and fallopian tubes. 31. CNS, culture and sensitivity, is a lab test to culture bacteria, viruses, or fungus and determine which treatments will end the infection. 32. C/S, culture and sensitivity, performed to detect infection. 33. C/O, complaints of, a blood test looking at levels of electrolytes and kidney function. 34 is, C, means, with. 35. CA, means cancer, or carcinoma. Example, a CA patient should eat and drink adequate fluids daily, during and after therapy. 36. CABG, coronary artery bypass graft. A surgery involving the heart. 37. CAP, means, capsule. 38. CBC, complete blood count. 39. CC, in uppercase, chief complaint. The patient's main concern. 40. CC, in lowercase, cubic centimeters. For example, body fluid removal is measured in cc. 41 is CCE, clubbing, cyanosis and edema. 42. CDE, complete dental or oral evaluation. 43. Chem panel, or chemistry panel, may be complete blood test for liver, kidneys, and electrolytes. 44. CKD, chronic kidney disease. 45. CMP, complete metabolic panel, is a blood test looking at levels of electrolytes, kidney, and liver function. 46. COAGS, the PT or prothrombin time, with INR, the international normalized ratio, and PTT or partial thromboplastin time, tests measure how thin your blood is, and how well your liver and blood thinners are performing. 47. COPD, chronic obstructive pulmonary disease. 48 is CPAP, continuous positive airway pressure. 49. CT, chemotherapy, a type of treatment therapy for cancer. 50. CVA, cerebrovascular accident or stroke. 51. D/C or DC, discontinue or discharge. For example, doctors may discontinue drugs or discharge a patient from hospital. 52. D or DX, differential diagnosis, list of diseases your doctor thinks may explain your symptoms. 53. DCIS, ductal carcinoma in situ, patient is having in situ ductal carcinoma treatment for breast CA. 54. DDX, same detail, as provided in 52nd point. 55 is DJD, degenerative joint disease, another term for osteoarthritis. 56. DM, means diabetes mellitus. 57. DM1, diabetes mellitus type 1. 58. DM2, diabetes mellitus type 2. 59. DNC, dilation and curettage, widening the cervix and scraping with a curette removes uterine tissue. 60. DNR, do not resuscitate. This order prohibits artificially resurrecting diseased patients. Near-death patients with DNR orders are not resuscitated. 61 is DOE, dyspnea on exertion. This means symptoms of shortness of breath that occur when you exert yourself. 62. DTR, deep tendon reflexes. Physicians use rubber hammers to evaluate these responses by hitting tendons. 63. DVT, deep venous thrombosis, for example, blood clot in a large vein. 64. DX, diagnosis. 65. DXT, deep X-ray therapy. 66. ECG or EKG, electrocardiogram. 67. ECT, electroconvulsive therapy, procedure used to control seizures or convulsions. 68. EOMI, extraocular eye movements intact. 69 is ESRD, end-stage renal disease. 70. ETOH, ethyl alcohol. For example, ETOH consumption is typically reported in patient history. 71, ETT, endotracheal tube. 72, EXT, extremities, like arms, legs, hands and feet. 73, F/U or follow-up. 74, FSH, follicle-stimulating hormone. Female fertility is assessed by follicle-stimulating hormone blood tests. 75, FX, fracture. 76 is, G, represents gram, a unit of weight. For example, the drug is available in both 30 and 60 gram tubes. 77, GI, represents the gastrointestinal. 78, GOMER, slang for get out of my emergency room. 79, GDT, means drops. The guttae means drops, in Latin. 80, GU, genitourinary, refers the genital and urinary tract. 81, GVHD, graft versus host disease. For example, acute and chronic GVHD make it more difficult to deal with. 82, HNH, hemoglobin and hematocrit. For example, anemia results from low HNH, or lung illness due to smoking or polycythemia can raise HNH. 83 is, HNP, history and physical examination. 84, HS means, hours of sleep, or at bedtime. 85, H/O or HX, history of, past event that occurred. 86, HA, headache. 87, HAPE, high altitude pulmonary edema. 88, HCT, hematocrit, a measure of red blood cells, used to rule out anemia. 89, HEAD, head, ears, eyes, nose, and throat. 90, hemoglobin, counts red blood cells, used to rule out anemia. 91, HbA1c, this test analyses last 3-month average blood glucose level. 92, HPI, history of the present illness, this is the information you share about the reason for your visit with your provider. 93, HPS, hantavirus pulmonary syndrome. A type of contagious, infectious disease is transmitted by rats infected with the virus. 94, HRT, hormone replacement or hormone replacement therapy. 95, HS, horosomny or, before sleep or, take a sleep. 96 is, HTN, hypertension or, high blood pressure. 97, IND, incision and drainage. 98, IBD, inflammatory bowel disease. For example, GI tract disease like Crohn's disease and ulcerative colitis. 99, IBS, irritable bowel syndrome, a medical disease that involves the GIT. 100, ICD, implantable cardioverter defibrillator. 101 is, ICU, intensive care unit. For example, patient moved to intensive care unit. 102, IDDM, insulin-dependent diabetes mellitus, type 1 diabetes. 103 is, IM, intramuscular. Common notation for muscle injections. 104 is, IMP, means, impression. The healthcare professional's summary of patient. 105, in vitro, in the laboratory. 106, in vivo, in the body. 107, IPF, idiopathic pulmonary fibrosis. Type of lung disease. 108, ITU, intensive therapy unit. 109, IU, international units. 110, IV, intravenous. 111 is, JT, joint. 112, K, represents, potassium, is an essential electrolyte is frequently monitored in ICU. 113, KCl, potassium chloride. 114 and 115 is, low back pain. LBP is one of the most common medical complaints. 116. LCIS, lobular carcinoma in situ. For example, breast cancer patient receiving lobular carcinoma in situ therapy. 117. LLQ, left lower quadrant. Diverticulitis pain is often in the LLQ of the abdomen. 118 is LMP, last menstrual period. For example, LMP date is used to estimate the baby's due date. 119. Lights, electrolytes, potassium, sodium, carbon dioxide, and chloride. 120. M/H, medical history. 121. MCL, medial collateral ligament. 122. MDS, myelodysplastic syndrome. 123. mg, also called as milligrams. 124 is ml, denotes milliliters. 125. MVP, mitral valve prolapse. 126 is N/V, nausea and vomiting. 127. NBCCS, nevoid basal cell carcinoma syndrome. 128. NCP, nursing care plan. 129. ND, nasoduodenal, used to describe a feeding tube that connects the nose to small intestine to deliver food. 130. Neuro, means neurologic, referring to the neurologic system. 131. NG, nasogastric, used to describe a feeding tube that delivers food from the nose to stomach. 132 is NJ, nasojejunal, used to describe a feeding tube that connects the nose to small intestine to deliver food. 133. NPO, nil per os, or nothing by mouth. For example, people who need general anesthesia for surgery might not be able to eat or drink anything before surgery. 134. NSR, normal sinus rhythm of the heart. 135. ONP, ova and parasites. Stool ONP is tested in the laboratory to detect parasitic infection in persons with chronic diarrhea. 136. OD, oculus dexter or right eye. 137. OS, oculus sinister or left eye. 138 is OU, oculus uterc, or both eyes. 139. O/E, on examination. 140. OD, omnindi, or once in a day. 141. ORIF, open reduction and internal fixation, such as with the orthopedic repair of a hip fracture. 142. OT, occupational therapy. 143. PO, per OS or by mouth. 144 is PRN, pro-renat, or as needed. For example, prescribing analgesics, exclusively for instances of pain, and not for situations involving injury, exemplifies a practice that ought to be avoided routinely. 145. P, means pulse. Pulse is recorded as part of the physical examination. It is one of the vital signs. 146. PC, post-cibum, or after meal. 147. PCL, posterior cruciate ligament. 148. PCP, primary care provider. 149. PD, progressive disease. For example, people who have proteinuria or hematuria are more likely to get a disease that gets worse over time in their kidneys. 150. P, pulmonary embolism, blood clot in the lungs. 151 is PERLA, pupils equal, round, and reactive to light and accommodation. 152. PFT, pulmonary function test, test to evaluate the lung functioning. 153. PLT, platelets, one of the blood-forming elements along with the white and red blood cells that help to stop bleeding. 154. PMHX, past medical history. 155. PMI, Point of the maximum impulse of the heart when felt during the examination, as in beats against the chest. 156. PMS, premenstrual syndrome. 157. PR, per rectum, or to be taken by rectum. 158 is PSHX, past surgical history. 159. PT with INR, the International Normalized Ratio, INR, is a way to compare prothrombin therapy, PT, readings from different labs. It is used to figure out how thin the blood is, and to help doctors decide how many blood thinners a patient may need. 160. PT, physical therapy. 161. PT, common abbreviation for patient. 162. PTH, parathyroid hormone. 163. PTSD, post-traumatic stress syndrome. 164 is PUD, peptic ulcer disease, a type of stomach ulcer. 165. PTT, partial thromboplastin time, another blood test that measures how thin the blood is and reflects how your liver is working and or how well blood thinners you are taking might be working. 166. QD, quay die, or each day, as in taking medicine daily. 167. QID, quater in dia, or 4 times daily, as in taking a medicine 4 times daily. 168. Q2H, every 2 hours, as in taking a medicine every 2 hours. 169. Q3H, every 3 hours, as in taking a medicine every 3 hours. 170 is QAM, quay anti-meridiem, or each morning, as in taking medicine each morning. 171. QHS, quay hora somni, or at each bedtime. 172. QOD, quay altera die, or every other day. 173. QPM, quay die post meridiem, or each evening. 174. R/O, rule out, when diagnosing, doctors often rule out several possibilities. 175. RA, rheumatoid arthritis, a type of joint disease. 176. RDS, respiratory distress syndrome. 177 is REB, rebound, as in rebound tenderness of the abdomen, when pushed in and then released. 178. RFP, renal function panel, blood test to find the levels of electrolytes in kidney. 179. RLQ, right lower quadrant. For example, appendix is located in RLQ of abdomen. 180. ROS, review of systems, comprehensive evaluation of respiratory, cardiovascular, and neurologic issues. 181. RR, respiratory rate. 182. RUQ, right upper quadrant. Liver is located in RUQ of abdomen. 183 is RX, means, prescription. 184. S/P, status post. For example, a person who had a knee operation would be S/P, a knee operation. 185. S/S, signs and symptoms. 186. SAD, season affective disorder, a type of depression that occurs during the winter months, when there is little light. 187. SIDS, sudden infant death syndrome. 188. SOB, shortness of breath. 189. SOCHX or SH, social history. 190 is SOS, SI opposite, or if needed. 191. SQ, subcutaneous. For example, an injection or shot given into the fascia under the skin, such as with insulin for diabetes mellitus. 192. ST, speech therapy. 193. STI or STD, sexually transmitted infection or disease. 194, TNA, tonsillectomy and adenoidectomy. 195, TID, means, tur and die, or 3 times daily, for example, taking medicine 3 times daily. 196, T, means temperature, recorded as part of the physical examination. It is one of the vital signs. 197, TAB, means, tablet. 198, TAH, total abdominal hysterectomy. A type of surgery to remove a woman's uterus, fallopian tubes, and ovaries. 199, TDS, tur die sumendum, or 3 times a day. 200, THR, total hip replacement. 201, TKR, total knee replacement. 202, TM, tympanic membrane. 203 is, TMJ, tempomandibular joint. 204, TSH, thyroid stimulating hormone. For example, blood test for TSH is used to diagnose thyroid disease. 205, TX, treatment. 206, U or U, unit. 207 and 208 is, UA or U/A, urinalysis. 209, ULN, upper limits of normal. 210 is, URI, upper respiratory infection, such as sinusitis or the common cold. 211, UT dict, UT dictum, or as directed. Taking medicine according to the directions that the doctor gave at past. 212, UTI, urinary tract infection. 213, VSS, vital signs are stable, means that the temperature, blood pressure, and pulse of the patient is doing well. 214, WBC, white blood cell. 215 is, WT, weight. Body weight is often recorded as part of the physical examination. 216, XRT, X-ray therapy or radiotherapy, a type of radiation treatment. 217, WBC, white blood cell. 218 is, WCC, well child check. The child's height, weight, and BMI, a height-to-weight ratio used to assess obesity, are measured. This information is displayed on an age and gender-specific clinical growth chart. Esteemed medical professionals, I have included the abbreviations of medical terminology in this video, as far as I am aware. It is possible that I may unintentionally omit some of the acronyms. If this is the case, kindly include the medical abbreviations used in your medical institute or hospital in the comment box. Remember to provide the name of your college or hospital, as well as the country it is located in. This information will be valuable for other doctors and healthcare workers worldwide. Please like, comment, share and subscribe. Good day all.